tells you you've got fibrinogen buildup in clots, in coagulation, and that is a good measurement to see if you have a good quality of blood flow or not. It's just called a PA1 marker. You can ask your lab. And another one is homocysteine and C-reactive protein. Those three markers are very important to determine if you have inflammation in blood. Okay? And
hi, before I introduce Brian Peskin, I would like to tell you who's coming the next 2 months. We have in April hypothyroidism by Mark Starr, who Dr. Galvin a few months ago showed us his book, and I don't know how many people have the book by Mark Starr on hypothyroidism. Interesting, I'll tell him to bring more. And in May we have someone talking about energy medicine. And let's see if there are any other announcements. Did I forget, Pam? Okay, and you heard the announcement from Bernd about people who are not paying their dues. We should do that to get all the equipment we have running in the back. Now, Brian's talk is based on a DVD he has, which requires a computer, which is being obtained right now, and will be in here in about 10 minutes. In the meantime, he will start without the computer, but as soon as it comes in, he'll put on his PowerPoint. Brian is the Chief Research Scientist of the Cambridge International Institute for Medical Science in Houston, and he's a world-leading physiologic EFE specialist, EFA, which is essential fatty acids. He earned his bachelor's degree in electrical engineering at MIT, and he founded the field of life systems engineering science, a new science of maximizing desired results by working cooperatively with the natural processes of living systems. He was appointed adjunct professor of clinical pharmacy in the Department of Pharmacy Practice at Texas Southern University College of Pharmacy and Health Sciences. Let me just see, I'll skip around here. He talks about science, not opinion. Studies are in science has become his trademark. Utilizing engineering principles allows him to distinguish between direct cause-effect relationships as opposed to mere associations or correlation. He began research in nutrition at the Houston Academy of Medicine in 1993, and it led to his being recognized as a pioneer in transforming existing Nobel Prize-winning research into practical solutions for quantum nutrition and optimum health, in particular in the field of essential fatty acids, while advancing scientific understanding of the role of EFA in the body's metabolic pathways. He has concurrently developed a means for alleviating cancer's prime cause, as postulated by Nobel Prize winner Otto Warburg, and proven by American medical researchers in the 1950s, culminating in amazing fundamental cancer-heart disease connection. Anyway, I give you Brian Peskin.
Thank you. Appreciate Mike and the committee for having me here. It's a very important topic, and it's a very complex topic. This is the reason why so many so-called experts are highly confused. Today's St. Patrick's Day was my grandfather's birthday. Man of remarkable intellect. And in his honor, I'll make this presentation especially insightful. Now, I've founded the field of life systems engineering science to work cooperatively with the natural processes of living things. The alternative to that is a drug. It's as unnatural as you could ever get. So we look at, what does the body want? How does it work? And I, being an electrical engineer from MIT, made the analogy, you have a system. System is your body. You have an input, it's called food. You have an output, state of health, size, illness. So the analogies are perfect. And the one place I guessed right off the bat was, the system is correct. Our body is correct. Nature and God don't make mistakes. There's no defective genetics. There's none of this stuff. The analogy would be, I have a Ferrari that doesn't run right. You could start out saying the timing is off, the spark plug wire is screwed up. I'd go, no, somebody put the wrong fuel in it. They put regular instead of the premium because it was cheaper. The car went wrong, so everybody'd be looking over here at the engine, spending all day long, and it's the fuel. I guessed the same thing back in 1995, that it had to be the fuel that's screwing us up. And it had to be something very, very big and prominent. Turned out the oils stand for essential fatty acids. I don't like that word. So I coined the term parent essential oils. Had to be something that's in every cell, and there are. If you didn't know it, there's 100 trillion cells. Half of every cell is fat. The other half is protein. There's virtually no structural carbohydrate in a cell. So out of that half fat, a quarter to a third are parent essential oils. What's the parent mean? It means the father. The difference is there's derivatives. Fish oil is all derivatives. And if you remember nothing else from what I'm going to talk about today, derivatives are made by the body as needed. DHA, EPA are the active components. There's fish oil, krill oil, mussel oil, I don't care. Any marine-based fish is omega-3 derivatives. And you're going to see pretty soon how very few of those you need. So the bottom line is, taking fish oil supplements, you are getting a supra-pharmacological overdose of 20 to 500-fold of what your body would ever produce on its own. There were 3 experiments done, all saying the same thing, giving this number. I'm not making it up. I have no vengeance against fish oil, by the way. I'm basically a theoretical physiologist, so I take a look and see what tissue the body has and what it's made out of, and what are we putting into it. A biochemist would look and go, okay, here's a reaction, blah, 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 blah. A physiologist starts out, well, what if I don't have the basic raw material? What if it's screwed up? What if it is adulterated, like the hydrogenated fats that Dr. Rubik talked about a little while ago? It won't work. But the biochemist doesn't care about that. It's a given that they're fully functional. But to a physiologist, they're not. There's not enough physiologists in medicine today, and that's why nobody, to my knowledge, has made the discovery you're going to hear about pretty soon. So you have parents, there's 2. There's parent omega-6, parent omega-3. Difference is only the number of double bonds. The technical thing, it doesn't matter. What matters is you can't get either one on your own. You have to get it from food. So where do they come from? Well, all meats, fish, flesh, any animal-based protein has omega-6, the parent, and omega-3, the parent. Now, the ratios will change depending on if the animal is grass-fed, if it's force-fed corn, because the content is always proportional to what comes in. So our tissues would be the same thing, too. If I give you an overdose of omega-3, you're going to have too much omega-3 in your system and cause all kinds of problems. So the biggest thing is there's adulteration and there's fully functional. What's adulterated today? The omega-6 component. Why? Because all the fast food restaurants, the frying, all the commercial baking, all the frozen foods, all the food in restaurants use omega-6 containing oil. Okay? Canola oil, sunflower oil, safflower oil. These are the omega-6 oils. They don't use omega-3 oils because they're too reactive. They go bad too fast. Okay, so that's why fish goes bad in 3 days. It smells, it's oxidation, correct acidity, it's good in the fish market for 3 days. So you can't have food smelling like that. You can't have vats of oil going bad. So nobody uses any omega-3. So the omega-3 you get will be very minimally processed. However, and what's changed today is virtually all the omega-6 you get is highly processed. So when you go to that supermarket and you smell the canola oil or the corn oil or any oil you want, there won't be any smell. The oils will look white. They don't go bad. You can take margarine, you can take these oils and put them out in your garage or carport. Come back a year later, nothing grows on it. No bacteria, no virus, nothing, because it's dead. Who cares? Well, you got 100 trillion cells, and in every one of those membranes, that cell membrane is responsible for what goes in and out. And everything is in the cell membrane. That is the brain of the cell, the membrane. So all the insulin receptivity, for example, there's a big epidemic of diabetes, insulin resistance. Probably a lot of you are type 2. Big problem with that is defective non-functional oils in that cell membrane don't let the insulin, or any hormone for that matter, come in efficiently. So you need more and more of it, and that's insulin resistance. There's been a lot of research in this area. The cell membrane is, almost everything in medicine is wrong. This was the title. Why almost everything you hear about medicine is wrong. Sharon Begley, Newsweek, January this year. How many people saw that? Not enough even. These are all quotes. What if wrong answers aren't the exception but the rule? The result's a system that leads patients and physicians astray. The very framework of medical investigation may be off kilter. New chief of Stanford University's Preventive Research Center, Ioannidis, MD, Dr. Science. People are being hurt and even dying because of false medical claims. Not quackery, but errors in medical research. Most biomedical studies are wrong. Isn't it shocking? Just 2 months, 2 pillars of preventive medicine failed. Drug companies make a mint on such dicey statistics. With billions of dollars on the line, companies are loath to declare a new drug ineffective. Made Ioannidis wonder how many biomedical studies are wrong. His answer in 2005, the majority. Stanford hired Ioannidis to run the center. He's the foremost innovative thinker about biomedical evidence. One of my things is there should not be a need to keep repeating studies unless the substance being studied doesn't work. If you do this, you're trying to get random chance to back up your study rather than science confirming the effectiveness. Experiments must confirm the scientific prediction, not be the opposite to it. Perfect example is gravity confirmed on a weekly basis. Now, contrast this to fish oil. Supposedly there's been 15,000 studies on how great fish oil is. 15,000. Does anybody here have a problem with that number? You should have a big one. It's stupid. You do 15, why would you do 15,000? You do one to show it, and you do another one to get it confirmed by somebody else. I do one, you do it over in the left-hand corner to confirm it, we're done. Just like gravity. You had a couple of them done, how fast something falls, how much distance it travels, you're done. Is anybody still proving gravity now? No. In the medical field, 10 years later, you're still going back, and it's insane. Start asking why. Here's a big thing. Absolute risk versus relative risk. This is your second paper, and you need to read it. When you get home over the next week, read that paper 2 or 3 times so you'll know how not to get misled by studies anymore. Here's a question for you. What's the difference between 1 out of a million and 2 out of a million? 2 out of a million get the disease without the drug. 1 out of a million gets the disease with the drug. So, the way I'd say it is 2 out of a million minus 1 out of a million is 1 out of a million is 0. There's no difference. Except if you're in the pharmaceutical industry. You know what it is then?
100%.
50, 1 out of 2. Right? What did they do? They got rid of the sample size. Well, if that was correct, then 1 out of 100 compared to 2 out of 100 would be the same as 1 out of 1,000 compared to 2 out of 1,000. 1 out of 10,000 compared to 2 out of 10,000. 1 out of 100,000. 1 out of an infinite number compared. It wouldn't matter. Statistics is always based on the sample size. It matters essentially. No good scientist would ever say it doesn't matter. But in 1980, the drug companies got to use this method. It's called the endpoint analysis, and it's very deceptive. So risk must always include sample size. That is the first thing. It has to be in there. Cause-effect relationships are mandatory. What they use at medical schools is called epidemiology. I have no use for it at all. It means an association. And here's the example. The sun gets up at 6 a.m., you get up at 6 a.m. What would the epidemiologist over at Harvard say? You made the sun arise. But if you did the experiment, it had you get up at 7 a.m., 8 a.m., you'd find the sun already up there at 6 a.m., you're getting up and nothing to do with anything. So there's no cause-effect relationship. So epidemiology is utterly worthless. You can use it to get maybe an indication, but I'd say it's worthless. You have to measure the direct thing, and this is why we're getting it straight. First thing is you have to focus on physiology. What is the tissue made up of? How much of something do you need? How does it work? The magical, we have no idea how it works, is completely unacceptable. For example, I say fish oil makes your skin better. How? There's no omega-3 derivatives in the skin. It can't possibly do it. So the first thing I go is, if it could, how would it? And nobody asks that. They say, yeah, it does. No. Does the science predict that it does? And that's a classic one. I've heard that so many times. Fish oil makes your heart better. How? There's no fish oil in the inner lining of your artery called intim. None. It's all omega-6 parent form. So I hear this stuff, and the first thing is, it can't. There's no case for anything else. It can't. So you can only vary one thing at a clip. Getting close? Yeah, I know. So the term is PEOs. That's what you want to remember. Forget EFA because everybody's using it wrong. People, the medical field, the health field, everybody is using EFA to define derivatives. Derivatives are not essential. They're made from the parents. So people are being highly misled, and they do it on purpose. Omega-3 to cook with, it's too reactive. You don't do anything with it. You don't bake with it. Nobody uses flax oil for baking. Goes rancid too fast. That has an extra double bond. So I'm talking about that. Omega-6 has 2 double bonds. The more double bonds, the much more reactive it is, and it's not linear. It goes exponentially, so it gets way, way worse. So an extra double bond makes it worse. You start talking 5 and 6 double bonds, it goes bad instantly. Fish oil, DHA, EPA, goes bad at room temperature spontaneously, instantly. Think about where it comes from, a cold water fish. They're living in very cold water. Different organism than we are. Never mind what happens when you put it up to body temperature, 98, right? Going bad. So, okay, your body has natural antioxidants to stop it from going bad. It does produce antioxidants. But again, what's happening is the antioxidants have to be taken from here to stop this fish oil from going bad over here. Boom. Now you have a deficiency. And it's been published. These oils go into the cell membrane and go bad and don't work. The parents don't. But if you're giving just doses of fish oil, and they did it in monkeys, very close to a people, it's a mammal, it's a primate, problem. And it's sucking all of your antioxidants away. 2010, 4 more fish oil failures. There's no metabolic pathways. Is the key thing you have to ask. What's the metabolic pathway for this thing to work? If there was to work, and the gentleman over there asked the question before. What's the pathway? How does it work? You have to know. To the contrary, they lead to failure. Now here's a big one. November 2010. These are all very current. DHA found in krill oil, algae, mussels, I don't care. Failed to improve the cognitive development improvement in Alzheimer's people. How many people saw this? You had people with mild Alzheimer's. You gave them fish oil, or DHA, the active component. And these people were deficient in DHA in the brain, okay? It didn't help them. Utter failure. Study was designed to determine if supplementation with DHA would slow the rate of cognitive and functional decline in patients with mild Alzheimer's. Despite enrollment of the target population of individuals with low baseline DHA, it didn't work. The hypothesis that DHA slows the progression of mild to moderate Alzheimer's was not supported. There's no basis for recommending this for patients with Alzheimer's disease. Now, your brain does have a lot of DHA. Your brain and nervous system, 3% body weight of your whole body, has about 20% DHA, very little bit of EPA. But it also has about 15% arachidonic acid, which is an omega-6 derivative. You never hear about that. So your brain does have it. But here's the perfect case of, with a deficiency, it didn't fix the problem. Well, if it doesn't fix the problem, how on earth would it prevent it to begin with? Because you're always told DHA is so great for the brain, right? Mental conditions, cognitive ability, all this garbage. It's harder to reverse something, or rather, it's harder to prevent something than it is to reverse it. And by the way, it's the same metabolic pathway. Think about it for a minute. How could I prevent something if I can't reverse it? It's the same pathway. They're the same thing. So if it prevents, it reverses. If you already have it, it reverses it. If you don't have it, you don't get it. Gave this before a group of doctors, not one even asked the question. Not one even saw it. However, a higher level of the parent significantly decreased the risk of mild dementia. And this was published too in a Journal of the American Medical Association in a Korean population in November 2010 also. So the parent work, even in the brain, because there's still a lot of parent omega-3 and parent omega-6, the derivatives didn't. Remember I told you your body makes derivatives as needed? Giving derivatives is not the answer, and it completely failed. That is so major to me that I can't believe anybody would even talk about fish oil after that. In March 2010, wordless and decreasing abnormal heart rhythm, that's atrial fibrillation. I've heard doctors say that fish oil helps it. This means a regular beating of your heart. Nope. But parent omega-6 did work. That was reported in the Lancet back in 1988. Physicians, by the way, also get heavily diluted. They see the results they want to see, and if it doesn't work, they blame you, the patient. It's a tragic state of affairs. The problem they get away with this, and I think about it all the time, is because the body is so damn good, it doesn't fall apart even given the wrong stuff. Put water in your car. It doesn't run instantly. It's going to seize up within a mile. Give yourself the adulterated oils. You're not dead for 40 years. Now, you're a mess. You have no energy. You have no vitality. You're sick. But you're not dead. So because the system, the body is so good, the medical profession gets a major pass. The only way that they get nailed is if they give you a drug and you die right away. And believe me, in the drug trials, that's why most drugs fail. You die. And you die right then and there fast. If you die 5 years later, that gets passed away too. You've seen all the lawsuits for all these drugs recently. They're under an interesting burden. Here's another one, June 2010. Women with type 1 diabetes receive no heart benefit from the omega-3 derivatives. Okay? You're told fish oil is good for your heart, aren't you? Isn't that one of the things people are told? It's stopped you from heart attack. I don't know why else you take it. Only two big ones are cancer and heart disease, so they're always saying fish oil is good to stop a heart attack. Well, in type 1 diabetic women, it did nothing. You know anything about diabetes, which is the #1 epidemic in America and the world? Diabetic patients are a perfect population because the risk of a heart attack is about 10 times bigger than the general population. So if there was a group of people that you could easily see if this stuff worked, it'd be diabetics. Complete failure. Complete and utter failure. October 2010, fish oil increases risk of colon cancer. Anybody see this one? We found that mice develop deadly late-stage colon cancer when given high doses of fish oil. More importantly, with the increased inflammation, so fish oil increases inflammation. Gee, what did I tell you inflammation does? Sucks the oxygen. What's that do? Gives you cancer.
You describe how bad studies are and how we need to be not believe these studies, but you're citing all of these studies. So
experiments. These are experiments. Experiments should vary one thing. I give you one thing, I give you something else. That's an experiment. An experiment you can. Or, well, you can. And in this case, keep going. Our findings support a growing body of literature implicating harmful effects of high dose of fish oil consumption. We hypothesized that feeding fish oil enriched with DHA to mice would decrease the colon risk. However, we found the opposite. That is in stone. I gave them this stuff. I thought it was going to make them better, and it made them worse. That is no bias whatsoever. That's as good as you get. This gave them a very aggressive form of cancer. No, these are all confirming that the fish oil stinks. So it's confirming, you haven't hit the science yet with why. So, I mean, I'm kind of stuck here because I don't have the PowerPoint thing, unfortunately. Contrary to expectations, dietary fish oil induced severe colitis and adenocarcinoma, which is epithelial tissue cancer of the colon. Now, epithelial is skin. It's also the inner lining of the artery, and it's the inner lining of tissue. It's all parent omega-6. There's no omega-3 in it, and there's no omega-3 derivatives in it. So flax oil with the parent omega-3 isn't going to help you there, and the fish oil isn't going to help you there. It's all the parent omega-6. Fenton said people already receiving enough omega-3 through their normal diets have no need for supplementation. Like I said, DHA and EPA from fish oil supplements range from 20-fold to 500 times what your body would ever produce on its own. And in this one, with the bad colon cancer, even the low-dose fish oil supplementation gave him the problem. And even low-dose fish oil supplements gives you these factors of overdoses than your body would ever make on its own. It should terrify you. 1995 was the first one. Fish oil is completely worthless in preventing or reversing heart disease. This was by Sachs et al. Controlled trial. That's what you want. It's called an experiment. I give you the fish oil, I give you olive oil, and nothing else has changed. Something else may change, but I can't put people in a cage. Okay, so an experiment is tough to do with people. He is actually making a control thing, and you throw you both in cages and feed you. You're eating what the hell I give you. It's not open. You're not going to do it. Did you eat the donut when I told you not to? You're going to sit there and lie and go, no, I didn't eat it. You ate it. But hopefully people are doing the same thing. So you're not going to change what you do. You're not going to change what you do. You just add this, you just add that, and you measure. The daily dose was 6 grams of fish oil versus 6 grams of olive oil. Now olive oil is a 0. There's virtually no benefit of dietary advice to men with angina. Results of a controlled trial. Study looked at patients with angina, that's heart pain by restricted blood flow, 2 groups, those consuming more fish and consuming fish oil supplements. Patients eating 2 servings a week had no protective benefits. This was even the oily fish they're telling you is good. 3 fish oil capsules had an adverse negative effect. More deaths. Is fish oil good for anything positive? No. Failure, 2000, decreases the immune response. Studies indicate that at the levels used, fish oil, the omega-3 derivatives, decrease a wide range of immune cell responses. Natural killer cell, cytotoxic T lymphocyte activities, goes on and on and on. Recent studies indicated that relatively low levels of long-chain omega-3 derivatives, EPA, DHA, are sufficient. Remember I told you how little the body makes on its own if you're getting pharmacological overdoses from even a little bit of this supplement. Remember, there is no omega-3 or omega-3 derivatives in the intima. The closest, it's a layer of skin in the artery. That is where the atherosclerotic process starts, inflammation. The omega-3 isn't going to help you at all. It's the omega-6. Fish oil decreases inflammation, doesn't it? No. But it does cause harmful brain abnormality. You wonder, where does all this excess go from the supplements? 2004, fish oil is worthless in decreasing inflammation. C-reactive protein, that's a measure of it? Well, it was current atherosclerosis reports. There's no evidence of an anti-inflammatory effect as judged by CRP levels. Okay, so it doesn't help C-reactive protein, so it's not going to decrease the inflammation for a heart attack. It's going to decrease prostacyclin, so any protection you have is out the window. 2 major things against it. These are physiological things. This isn't a study. This is absolute. I measured the darn thing directly. 1992, 1990, 1988, fish oil creates abnormalities in the brain. Feeding fish oil to adult rats. I got to be careful with animals that aren't people. But when it comes to rodents and the way they metabolize EFAs, Lanz was an excellent biochemist guy that showed you can look at it. It's metabolized the same way. So the adult rats resulted in rapid increases of all the omega-3 series, which is usually present in the brain in only trace amounts, and it decreased the omega-6. Remember, if I get this huge overdose of the omega-3 derivatives, it has to displace something. Your body can't burn it up. It's getting shoved in wrongly. I have brains that are screwed up. Nevertheless, these findings may be of relevance to questions concerning the provision of long-chain omega-3 from fish oil in human infant feeding because they're loading it with DHA in the infant formulas now, right? And you need a little of it, it's in there. Actually, you don't need much. I'll talk about that after. But here's another great one. Fish oil for diabetics, because you're told that it lowers triglycerides. Well, it's awful for a diabetic. 1988, 1989, 2003, fish oil raises blood sugar levels and blunts the insulin response. How many people knew that? Take fish oil, your blood sugar goes up, and it blunts the insulin response. Blood sugar control of all 4 insulin-dependent diabetics worsened during fish oil administration. You can say it's only 4, but when it's 100%, that's gutsy. Glucose tolerance with a mixed meal deteriorated significantly. The insulin dose had to be increased and increased. The more insulin you have to give to somebody, the more you risk of a low. And it's the sugar lows that give the problem. It's not as much as the highs, as they've said. That's been wrong. It's decreasing the fuel, decreasing the low. Another important finding of our investigation was that consumption of fish oil enriched diet worsens glycemic tolerance. The rate of glucose disappearance decreased by 26%. Was observed in healthy human patients in a 3-week supplementation of 6 grams a day. It's not too far off from the normal amount. Decreased by 40% the insulin response to an oral glucose challenge. That means 26% too high of glucose is staying in the blood, which if there's any athletes in the room, that's the worst thing you want, because when you're under intense physical endurance, the muscles want glucose. You're keeping it in the bloodstream. You're depriving your muscles of fuel. If you're an athlete, taking fish oil is the worst thing you can possibly do. And it decreased by 40% the insulin response, which means the blood sugar stays there. It doesn't get rid of it. You do not want to be running around with crazy high blood sugar levels. Here's another big thing. The long-chain omega-3 fats, the derivatives, are incorporated in the membrane, remains altered at least 18 weeks after stopping. So that means for 4.5 months, I'm stuck with the negative effects of this fish oil in the membrane. And I'm going to show how that turned out clinically in a little bit with the experiment we did. Perfectly, so it's consistent. Again, where does this stuff go? It gets shoved into places and it takes time to displace it. Fish oil is awful for everyone. 2011. Fish oil caused increased cellular oxidative stress, leading to decreased lifespan. This was in mice, and they took a gene so that it couldn't. Let's see, what did they do? Yeah, I'll tell you in a minute. But here's the conclusions. These findings suggest the intake of fish oil increases oxidative stress, decreases cellular function, and causes organ dysfunction, thereby promoting aging and shortening the lifespan of the mice. How could it do this? Because you're getting a pharmacological overdose, which is a drug effect of a poison. If anybody cared to look how much of it, which is appalling to me too. How can a company or an industry be allowed to be giving you stuff in dosages no one has looked at to see what your body makes on its own? I mean, aren't you appalled with this? I think you should be. Therefore, fish oil intake may also influence the lifespan of humans. Aging is promoted by an increase in oxidative stress in diabetic patients who have ingested a large amount of EPA and DHA. This did not happen, however, with the omega-6 containing oils, safflower oil. Didn't do anything. Remember all these long double bonds, 5 or 6 of them, and I told you they go bad at room temperature, so cook it up to 98 degrees. It's going bad by instantly. You're not supposed to have this. Sardine oil started out with a peroxide value of 2, which is superb. You can have a peroxide value of 30 before there's a real problem. So you could say, okay, the fish oil was screwed up to begin with. That's what did it. Nope. It didn't have a problem. It wasn't oxidized. So it didn't come in adulterated. Remember, like I told you, the omega-6 is coming in adulterated and attaching to the cholesterol molecule, adulterated to begin with. It's not happening in the body. This fish oil came in fine. It went bad in the body because of the darn heat. Present data showed that monkeys were not fully able to compensate for the increased peroxidative stress. They needed a 4-fold increase in vitamin E to reduce it. Lipofuscin, which is the cause of age spots. Anybody has age spots on their hands, the brown age spots? That's oxidation. So if you have them, you got a problem because that's going on inside your body too. It's used as an indicator of the in vivo, meaning inside the body, lipid peroxidation. It was threefold higher in the fish oil group. 4 times higher based on another measurement. So this is a major problem. It's measured in the body, and nobody's doing anything about it. Pharmacological grade fish oil, okay? There's an extra pure fish oil, so it's even more concentrated with DHA and EPA. Guess how many pounds of fish it takes to make one of those capsules? How many pounds would you think? 17 pounds. In one bottle of pharmaceutical grade fish oil, now that says pharmaceutical grade, a lot of it isn't, but there are brands that are pharmaceutical grade. I think Barry Sears has one. 1,700 pounds of fish for 100 capsules. Now, isn't there something heavily wrong with that? Where do you think this whole fish oil thing came from? Think about it. They had spoiled, rotten fish they couldn't sell to a restaurant. Okay? So if I can't sell it to a restaurant, what do? You go to the nutritional market, and that's where you get rid of waste products. And that's exactly what happened. How do you think fish oil gets processed? They grind up the whole thing. Remember Saturday Night Live, the Bassomatic with Dan Aykroyd? They're dropping it just grinds it up. Then you got to filter it out. It's a stinking mess. Why would a human being have a deficiency of this stuff? And then to make the claim that it's great for you, you got to be a lunatic. Again, I know the result. I have to sell this stuff. So what do? You get a lot of money. You go to universities. I'm going to give you $1 million. Show this stuff works. Yes, sir. Because you come back and say it doesn't work, you're out of a job. It's as simple as that. It's finance masquerading as science. And it sickens me and it disgusts me, but so what? That's how you get all these studies saying the same thing. I look for studies that are negative. And by the way, they're very hard to get published. Medical journals do not want negative studies. They hate it. They want nothing to do with publishing. It doesn't work. People in the research community don't get paid well for saying it doesn't work. Who's going to fund that? I'm a fish oil manufacturer. I'm going to pay you $1 million to have me come back saying this stuff doesn't stop a heart attack? Like heck, I'm going to make 15 excuses up how it does. And it's called surrogates. Because what you do is you try and look at stuff as a measure of the thing. For example, statins lower cholesterol. Cholesterol is completely irrelevant to a heart attack. Completely. It always has been. But you use it as a surrogate. Why? Because I have a drug that can lower cholesterol. So I have the damn thing. Now I've got to figure out what's it good for. And that's the way drug companies work. They find that it does something, and then you got to figure out what can I use it for. And it's almost never a direct measurement of something. It's always a surrogate. So surrogates stink, but they're very, very common. So LA and ALA, that's the two technical definitions. LA is parent omega-6, ALA is parent omega-3. They're both essential. The body can't make them. How much goes to derivatives? That's the big thing you need. Remember I said it's very little? It's less than 1%. So the parents stay in parent form. Here's the mistake all the physicians make. Oh, all the parents go to derivatives, so we'll be gentle on the body and give it the derivatives ready-made. Perfect. Except nobody looked at how much derivatives does the body make. Less than 5%, actually it's less than 1%. 99% of the parents stay in parent form in the cell membrane in every one of your 100 trillion cells. Unless you overdose it with fish oil, then it gets shoved in there. Remember I told you that epithelial tissue, your skin, has no omega-3 component? It's all omega-6. Well, guess what happens? I take tons of derivatives from fish oil or marine oil or krill oil. Some of that gets shoved in the skin. What did I tell you the skin was? Or is highly reactive to temperature? Now I have the sun hitting my skin, getting hot. I get this fish oil in the tissue. It's going bad. It's oxidizing. Oxidizing is inflammation. Inflammation is something called skin cancer. This is why the dermatologists have no clue how to stop skin cancer. They have everybody going in out of the sun, everybody using suntan lotion, and it hasn't decreased a bit. Yet in the South American climates, where there's tons of sun, nobody's using any of this stuff, they don't have the skin cancer rates, and nobody goes, what the hell is going on here? Remember, again, connect the dots. I look at the science, and you look at what we're doing, and everything can get explained. You can't be having negative results if something works. It better be the same result all the time. And this is why medicine gets nowhere. It's a rat in a treadmill. They've gotten absolutely nowhere. All the advances in medicine are from electrical engineering or medical physics. CAT scans, MRI scans, not medicine. None of it is. Then you get better technicians, you get a better surgeon, that's a technical thing. I can't even call that medicine. The drugs, minimal. The improvements in medicine compared to the improvements in computer going from the size of a refrigerator 25 years ago to this sucker should make anybody in medicine embarrassed walking with their head to the ground. I kid you not. It really should. It really, really should. Now, I'm empathetic to physicians. I mean, I have tons of colleagues that are physicians, but their hands are tied. I mean, they're really puppets of the drug companies, and that's a pharmaceutical rep. It puts them in a tough position. They have to give you drugs, and most of the drugs don't work. That's why they use relative risk. Their 1% success rate, by the way, all the drug company needs is a 5% difference. So that's the relative risk thing. 5% success, that's 95% failure. 95 out of 100 skyscrapers are going to topple? Yep. Brilliant job. That's worth about $500 million, by the way, to get that result. I look at it from an engineering viewpoint, not as anything else. So again, pharmacological overdose, fish oil can't and doesn't work. Period. If it did, how could it? It doesn't. And you go from the physiology. And I give a big lecture at the American Academy of Anti-Aging Medicine. Pretty much this, but really geared towards heart disease. Not much on the fish oil problems. And doctor comes up at the end and goes, I teach physiology to physicians. You went over the head of everybody in the room, Brian. You even went over the head of me because I couldn't follow a lot of what you're saying. I said, Doc, I got 40 minutes. I got to cram 4 hours worth of stuff in for you. So all I can do is hope that I get your interest up enough so you go, I've never heard a guy talk like this or give me this kind of stuff, and go home and study. But this is, I said, aren't there physicians that are skilled in physiology? He goes, no, none of them. They don't want it. They don't want physiology, and that's why they get nowhere. It's a tragic state of affairs. Somebody raise your hand.
What about fish oil and bleeding?
I've heard it increases bleeding. I've heard other things where it doesn't. I can tell you that the PEOs do not at all. We did an experiment with a big plastic surgeon in Italy, because I have some colleagues over there. He looked at 4 to 5 major plastic surgery cases. I mean, this is multi-hours, 4 to 6 hours. No problem at all. And the healing was just unbelievable. And we have all kinds of confirmation, too. With the fish oil, I don't know if it increases bleeding or not. They say it does. I've seen other things saying it doesn't. To me, the bleeding thing isn't the issue. It's just wrong. It's just physiologically wrong. Super newsflash was fallacy destroyed 1996. I've always heard from the physicians, babies don't produce derivatives. You got to have them. Well, yes, they do. Babies do produce AA, which is arachidonic acid made from omega-6, the parent, and then they DHA, which is the omega-3 derivative. They looked at them, this was in pediatric research, top journal, 1996, at 1 month of age. So you have all these people with dogma. Oh, they don't produce derivatives for a year. I heard this from all kinds of physicians. Wrong. It's just a tragic state of affairs. And this was in the body, they could measure it. So developed a new approach which enabled us to measure in vivo in the body the biosynthesis with stable isotopes. 2008, major news flash confirmed again, this is the 3rd time EFA derivatives are made as needed. Quote, which shows the effectiveness of LAA conversion into DHA and EPA, the amount of ALA required are easily obtained in the general population. There was an independent confirmation. This was the USDA Department of Agriculture. People could say, okay, these studies, I don't like them, we did it, blah, blah, blah. Our government did it, if anyone would care to look. This was done, Journal of Lipid Research, which is phenomenal Journal of Fats, 2005. Overall conversion rates, 0.18 and 0.2%. Remember I told you it's less than 1%? This is 0.2%. It's next to nothing. Next to nothing. Conclusions, why they had these problems. This was European Journal of Clinical Investigation, had this to say about the overestimates. You know, why all the physicians think that all the parents go to derivatives. Using areas under the curve, which is the simple standard of analysis, overestimates the conversion because resident times aren't considered. They didn't look and see how short of a time something stays before it goes away. And you can do it with radioactive isotopes. I mean, it's a standard way to do it. So bottom line is you just had rotten experiments back then. Now they're much more technically sufficient. The derivatives are next to nothing. You have 2,600 times more parent omega-3 than DHA. 2,600 to 1 is how much more parent omega-3 is in the body and the tissues than the DHA you're getting, than the DHA that's in the tissue. So you take that fish oil. Why continued fish oil failures? I had some great slides. How do you juice a fish? In a juicer. It really is that bad. They're not doing it with cod liver oil or liver oil, just the whole damn fish. Grind it up, have a big mess of slop, and filter out the oil with chemicals and however you do it. What about fish oil? It's not bioidentical. The big thing is bioidentical hormones. All women are familiar with that. The synthetic ones stink. You really want a natural one, so it has the 3 components of estrogen, for example, not just one. That's the 80%, and the physicians figure we don't need the other 2 because they're only 10% each. Smarter than Mother Nature, once again, like I can adulterate the fats and they work just fine. No. Nature doesn't make mistakes. We screw it up. Can't blame nature for our stupidity in adulterating food. Now, I can't blame the food manufacturers because they have to have food that stays long, right? It can't go bad in 3 days. So you can't have bagels, pasta, and rice smelling like fish that's gone bad. So they fixed the problem for themselves, but they never told us, look, we're killing you. We're giving you heart disease and cancer. Because back in 1900, 3% heart disease and cancer. I know what you're thinking, but we didn't live long back then. Wrong question. We lived pretty close as long, given that you made it to age 20. It's called a conditional probability. The intelligence of the answer is proportional to the intelligence of the question. That's a big comment of mine. Think about that again. The intelligence of the answer is proportional to the intelligence of the question. You better ask damn intelligent questions. The lifespan thing is given that I made it to age 20, because there was a 20% death rate before age 20. So this killed everything. Given that I made it to age 20, what's the probability I'd live old? Well, it turns out today, a man lives about 8 years longer and a woman lives about 15 from 1900. Wait a minute. We're not even talking about the caliber here. I can keep you on life support, or a doctor could. You're dead. You're still counted, by the way, or you're a mess. People over 70 as a rule are typically a mess. 75, you're really bad. 80s, you're just awful, but you're kept alive. As a guy, I'm living 8 stinking more years than somebody in 1900, given better supermarkets, better physicians, better drugs, better sanitation, no problem with food. Think about what happened in the 1800s. You go across the country, or 1900, you didn't have supermarkets. You got stuck in a snowstorm, you're dead. That's all gone. How can I only be living 8 stinking more years? So something's got to be slamming it back. The adulterated food. Now the problem with fish oil has nothing to do with the chemicals in it and any of that stuff. It's wrong physiologically. I want to make that very, very clear to you. It has nothing to do with pollution in the water. All of that, it could be the most pristine fish in the world. It's wrong physiologically. Human beings don't have a fish oil deficiency. Take a look in the mirror. If you don't see a big fish looking back at you, you don't need this stuff. But if you do see a fish looking back at you, you got a big problem. Probably if you're mentally ill from taking a fish oil. There's a couple of things. How do I prove this? The fellow over there was asking this. Lipids in the bloodstream. When you look at the plasma, it's 8.5 to 1 in favor of parent omega-6 to omega-3. Plasma triglycerides, 17.5 to 1. We're always told we're getting so much more parent omega-6 than omega-3. Plasma phospholipids, 115 to 1, parent omega-6. Plasma cholesterol esters, 100 to 1. So the amount of the parent omega-6 compared to the omega-3 is enormous. You want plenty of omega-6 in unadulterated form or you're in trouble. 70% of the cholesterol and the lipoproteins in the plasma are the esters. Remember I told you that's attached to the PDOs. The dietary cholesterol eaten, there's cholesterol in any animal-based foods, 80 to 90% is esterified. The majority of the esterified component is parent omega-6. It's about 55%. So the vast majority, there's very little of the omega-3 along with the omega-6 being magnetized to that cholesterol molecule. And you can see these charts later on. I'm sure they'll have a PowerPoint thing on the
Website.
on the forum later. So it's 11 to 1. Here's a ratio of the tissue. The brain nervous system, the skin, the organs. And you'll see again the vast amount. Biggest thing with the omega-6 is 50% of it is non-functional. This is how you can have margarine sitting out in the garage for a year and nothing happens to it. So it's lost the oxygen transfer. So you need more parent omega-6 with some parent omega-3.
Does this ratio of 11 to 1 come from looking at a population whose omega
Changes is what it's attached to. Now the cholesterol molecule itself can oxidize, but much more often it's the oxidized omega-6 coming ready-made from the screwed up food that's the problem. And there's a big picture here. The cholesterol that's tied to the parent essential oils is huge. That's the majority. There's a little free cholesterol and some other technical stuff. World-leading biochemist Dr. Spyteller, and I've conversed with him, concludes it's the oxidized cholesterol esters that are responsible for the initial endothelial tissue problem. The endothelial is that inner lining of the artery. So that's where it starts. LDL is basically a chemical transporter that dumps it. Now statins have an NNT. This is called number needed to treat, and very, very few physicians are familiar with this. That is the only measure you need to give me to tell me how effective something is. NNT means how many people have to be treated to get one positive result. Statins are 80 to 100. Typically 100 is great, 100 stinks with an NNT. That means I give the treatment to 100 people, I get 1 plus. Works for 1, that means 99 failure. An NNT of 1 means every person I give it to, I get a success. And that's what you want. That way? So essential fatty acids, which is an EFA, is a PEO, parent essential oils. Get rid of the term EFA because they're all using it improperly. You need to be talking parents. So you're getting this without
Yeah,
PowerPoint?
it's working.
That's pretty impressive. That's pretty impressive. Page 46.
Because it's got to go once more.
No, it's fine.
That's it.
See if you do anything about it.
You can just push.
Okay, page 46.
Good luck.
How do I get, how do I share that?
Just
What do you mean?
go slide by slide.
How do I get to 46?
That's all right.
Oh, that's okay.
The next set though is on 2 monitors.
Okay.
So you can see it there.
Pick your.
Oh.
Pardon me?
We got 15
The one
slides.
that has the square?
Do
Oh,
what?
that's over the page.
It's okay, you can look at there, don't go complicated. Just look at one, don't worry.
Yeah, the slides are, can you put this up on your site so people can download it later?
Yes.
Good.
Yay.
Yeah, we can do that.
Oh, yeah, this isn't meant to talk to us like this.
That's smart,
I'm gonna have some.
Okay, that's enough.
Yeah, that helps.
46.
Okay. the intima. That's the innermost layer of the artery. It's all parent omega-6, no omega-3. And if you bring in the processed omega-6, you're having a normal oxidation, and that causes the problem. So it's all the adulterated food, not the body itself. There was a big success in 2009. The American Heart Association championed you need parent omega-6. Says it had a bad reputation. It came about because of arachidonic acid, which somebody like Barry Sears is a building block for inflammation. It's a rather naive understanding of the biochemistry. That's like something I'd say. So I think this fellow probably saw my work somewhere. But that's pretty well put. A naive understanding of the biochemistry. Omega-6 has powerful anti-inflammatory properties that counteract any pro-inflammatory activity. It's incorrect to view omega-6 fatty acids as pro-inflammatory. Very, very important. So the next person that tells you how bad omega-6 is, they're a parrot. Take a parrot and put it on a human body, a parrot's head, and that's what you got. I get so tired of parrots that have no idea of a metabolic pathway or where it came from. They just blindly repeat, and that's why the field doesn't get anywhere. And that happens in the medical profession tragically. Tragically, they have very little understanding. Now, PGE1 is an omega-6 derivative. It's the #1 anti-inflammatory in your body. Much more potent than any omega-3 series. Okay? #1 antioxidant. And it stops fiber degradation. Fibrin. So fibrin is what causes that clotting. This can reverse it. And it's omega-6 based. Prostaglandins, limiting the clogged artery and reverse it. Got a book called Prostaglandins in the Cardiovascular System. Remember, I'm in Houston. I have the biggest cancer center in the friggin' world right in my backyard. They don't know Otto Warburg, the oncologist there. That's how bad it is. My own backyard, I've asked 5 of them. Do you know this name? No.
Wow.
50 years ago, every physician there was knew his name. They didn't know how to solve the problem, but they knew his name. I knocked that down, but I'm not an Atkins no carver. You don't need to be eating like a billy goat all the time. You take these oils, you're not hungry all the time. So it's mainly 1 meal a day. And I've added some fruit because of Dr. Rowan. We have a new collaboration. Dr. Robert Rowan, a second opinion. He's added a lot to my understanding of things. There are PEOs in fruit. And I was shocked to even hear that. Now, there's not a lot of them, so you need to eat some amount. But if you're not eating adulterated fruit, you don't need that much. So the fruit helps. It also fulfills the appetite. What I've noticed with the PEO supplement and the fruit, fruit will not raise your blood sugar. There is fructose in it, and everybody will tell you fructose is bad. High fructose corn syrup is bad because that's adulterated. So the fruit is natural fructose, and there's glucose. What was really interesting to me was the glucose in the fruit did not raise a type 1 diabetic's blood sugar. And it turns out there's many different pathways. There's different GLUT transport systems. GLUT4 is the insulin one. But there's also 1, 2, 3, 4, there's lots of them that don't use insulin. So your nervous system is running on glucose without the insulin. So it doesn't make you fat, it's phenomenal. So I've added more fruit, like a ½ pound of fruit a day, watermelon, cantaloupe, strawberries, blueberries. I try for organic if I can. And that takes away your sweet tooth, so the ice creams, the pizzas, you know, the pasta, all the human billy goat syndrome really goes. I thank Dr. Rowan for that. But I still will eat the saturated fat, the meat, the chicken, fish. Typically last night I'm at the hotel, so I had a big steak, baked potato, and I think creamed spinach. I mean, you're pretty full after that.
How about coconut oil?
Coconut oil is excellent. I recommend to any of the companies I consult with have some coconut oil in the PEOs because it helps stop their oxidation. It's a fully saturated fat, 93% saturated. Coconut oil is superb. We used to have it for popcorn in America until Canada came in and got the government to switch it. So now there's canola oil, which is awful, and they got rid of the coconut oil. And the coconut oil, extra virgin, means the first pressing. It smells coconut, but but the coconut doesn't impair into any of the food, so it's perfect for fried food.